I'm Dr. Robin Eickhoff, a Senior Medical Director at WellMed Medical Group and part of WellMed's COVID-19 Task Force. As you probably already know, the COVID-19 vaccine is here, and that is great news. Now, I know and understand there are some concerns about getting the vaccine, so I want to take a moment to give you some accurate information about the vaccine and answer some common questions so you're informed as possible when making your decision about getting the vaccine. Let's get started. You're probably already familiar with the coronavirus that causes COVID-19, but in case you aren't, let me give you a little history. The first outbreak was discovered in December 2019, and it very quickly spread across the world, becoming a pandemic by March of 2020. Since that time, COVID-19 has taken the lives of over 360,000 people in the United States and caused around 1.8 million deaths worldwide. The COVID-19 infection can be silent, what we call asymptomatic, but it can also cause severe illness and ultimately death in high-risk individuals. This virus does not discriminate. It affects people of all age groups and backgrounds. However, the highest risk for severe cases and death is in people over 65 years of age, people with chronic health conditions like obesity, lung disease, heart problems, and in our African American and Latino populations. We know it's possible to successfully slow the spread of the virus by consistently wearing face masks, social distancing at least 6 feet apart, frequent hand washing, and avoiding crowds. We have all been patiently waiting for a safe vaccine to be developed. And here we are now with the really good news that we finally have vaccines, and these vaccines are being distributed all over the United States. So far, over 6.5 million people have already received their first dose. There are several different vaccines out there, developed by different companies, but the ones that have been currently authorized in the United States, while slightly different, all do basically the same thing. They prompt our own body's immune systems to make something called antibodies, like little internal soldiers, to protect us. The vaccines do not contain the actual virus, and they cannot give you COVID-19. These are known as mRNA vaccines, and the technology to make them has been around for quite some time. As you may know, these vaccinations are being given in a certain order of priority. The first individuals vaccinated are mostly healthcare workers who work directly on the front lines of our battle against COVID-19, directly caring for patients, hospital workers, nurses, doctors, and other healthcare providers, and our most vulnerable patients, those in nursing homes and long-term care facilities. As we get through vaccinating these folks, our next step is to get other high-risk people vaccinated as quickly as possible. Eventually, we will get everyone vaccinated, but right now, we want to quickly focus on people most at risk from COVID-19 infections. I sincerely hope that if you are undecided about getting the vaccine, this video will give you enough information that you will decide to go ahead and get it. We really need as many people as possible to get the vaccine in order to stop the spread of the coronavirus, stop overwhelming hospitals, and maybe, just maybe, to get back to some form of normal in our daily lives. That can't happen without you. Let's talk about some of the concerns I've heard people have about the vaccine. While vaccines have some risks, all vaccines have risks. There are things being said about these coronavirus vaccines that are simply not true. I've heard people say that individuals with cancer, Down syndrome, heart disease, lung conditions like COPD, kidney disease, or a weakened immune system cannot get the vaccine. That is all false. Any of these individuals can and should get it. Even women who are pregnant can get the vaccine, although we do recommend that they discuss it with their doctors first. None of these conditions prevent someone from getting the COVID-19 vaccine. None of them. Of course, if you have any concerns or questions about your personal situation, you should talk with your own doctor or healthcare provider. The only strict reason where you should not get the vaccine is if you have had a severe allergic reaction known as anaphylaxis from this specific vaccine or from an ingredient in the vaccine. If you have had bad reactions to other vaccines or a severe allergic reaction before, please be sure to talk to your healthcare provider or the person vaccinating you before they give you the shot so they can advise you what you should do. Generally, this vaccine is well tolerated. Most people have no side effects at all. But just like any vaccine, there are some things someone might experience. Again, these are just some possible reactions and don't happen with everyone because everyone is different. There might be some pain and redness at the injection site, like a sore arm. I certainly had some, but it didn't last for more than a day or so, and it didn't limit me in any way. I slept fine and could do all of my usual activities. There might also be some muscle aches, a slight headache, or feeling tired. A very small number of people may experience a slight fever or chills. If any of these things develop, it's actually a good sign that the vaccine is doing what it's supposed to do, triggering your immune system to make antibodies that protect you from COVID-19. Let's talk about some of the other questions that have come up about the vaccine. If you choose to get the vaccine, and I hope you do, you will still need to do all the things we've already been doing to stop the spread of the virus. You need to keep wearing your mask, stay 6 feet apart from other people, avoid crowds, and wash your hands often. Why? Because 1, you won't get to full immunity for a few weeks after the second dose. And 2, we don't really know for sure yet if you can still spread the virus to others even if you do get the vaccine. If you've had COVID-19 infection already, you can still get the vaccine, but you should wait at least 90 days after you recover to get it. Most evidence shows you're immune for at least that long, so it's safe to wait. If you choose not to get vaccinated, of course, you remain at risk for getting COVID-19 yourself, but you can also become a spreader of the infection, which could then cause someone else to get sick and even severe illness and ultimately die. Remember, if you do get the vaccine, you need to come back and get a second dose. I cannot emphasize enough how important it is for you to return for that second one so you can get the full protection the vaccine offers.
Thanks, Dr. Eickhoff. I'm Dr. Matt McGlothlin, Senior Medical Director and Senior Editor for the WellMed Morning Rounds. I'd like to take a few minutes to answer some specific questions that have come up around the COVID-19 vaccination and, like Dr. Eickhoff, try to assure you that this vaccine is safe and crucial to getting us all through this pandemic. Dr. Eickhoff has already addressed some of the questions around the safety of these vaccines, but I want to go over a few additional things. First, let me restate that you cannot get COVID-19 from this vaccine. There is no virus in the vaccine. Another concern we've heard is about the mRNA in the vaccine getting embedded into our own DNA. This does not happen. mRNA does not enter the nucleus of the cell, which is where our DNA is contained. Once your body makes the protective COVID-19 antibodies, the vaccine's mRNA contents degrade and disappear. There is no microchip embedded in the vaccine. The volume of contents actually injected into your arm is only 0.3 to 0.5 milliliters, or 10 to 12 drops of liquid for the Moderna and Pfizer vaccines, respectively. I don't know of any technology to create a microchip or tracking device that small. These vaccines cannot make you infertile. This is another completely false myth that we've heard. Again, your ability to have children is unaffected by this vaccine. Let's address a few other questions. Can I go to work following vaccination if I'm experiencing side effects or symptoms? Do I have to take sick leave? After your vaccination, if you have a temperature over 100 degrees Fahrenheit, you should stay home regardless of the cause of the fever. Keep your supervisor appropriately informed. Fevers following a vaccine typically last less than 24 to 48 hours. If necessary, you can use your sick leave days or will be given time off until you can return to work. We don't want anyone at work who could potentially spread this virus. I'm young and relatively healthy. If I get COVID-19, I'll almost certainly survive, so why should I get the vaccine? Some employees might feel that since they are young and healthy, they're not likely to become seriously ill from the virus, so they don't really need to get the vaccine. This sort of thinking is short-sighted. Without vaccination, you remain at higher risk of spreading the infection to loved ones, patients, or your coworkers. Only by having a large percentage of our population immunized can we reach the critical point of herd immunity that will deny the virus the opportunity to continue to infect others. What about for those individuals who have already had COVID-19? When can they get the vaccine? Where do they sit on the priority list? Once a person has had confirmed COVID-19 with either a PCR or an antigen test, we have good evidence that they remain immune to reinfection for at least 90 days, so we're asking that those people wait the full 90 days before getting their vaccine to allow other, more susceptible people to get it first. Once 90 days have passed, the individual would keep the same priority as before. Healthcare workers would remain in the first group, or 1A, while other employees who are over 65 years old or have chronic medical conditions would remain in the second, 1B priority group. We've had some questions around the safety of giving the vaccine to people having specific medical conditions, like multiple sclerosis or a history of Guillain-Barré syndrome. While we have heard that there are some neurologists or other specialists who are hesitant to recommend the COVID-19 vaccine to patients who have had Guillain-Barré, it is not a contraindication according to the CDC. As for multiple sclerosis, we recommend those patients get it as well to give the maximum protection against the virus. Of course, if you have questions around your personal medical history and getting the COVID-19 vaccine, we recommend you discuss those with your primary care physician. As Dr. Eickhoff mentioned, it's important to return for your second dose of whichever vaccine you received. It's important that you return to the original location where you got your first dose. We are trying to ensure everyone gets both doses from the same manufacturer at the correct time. To accomplish this, we are scheduling the second dose at the time you receive your first dose. Doing that at the same location makes tracking much simpler and more accurate, and helps us ensure that you don't show up for your second dose only to find we don't have it available for you. For Pfizer, the second dose should be done on day 21 if at all possible, but the range is between day 17 and 21. While for the Moderna vaccine, the second dose should be on day 28. With the recent changes from the federal government around releasing all of their current doses, even those previously held back to ensure second dose availability, we aren't sure if or how that will change the timing. But for now, expect to get your second dose as scheduled at the same place you originally got it. I have heard that some pharmacies in Dallas have told patients that they couldn't guarantee they would have their second dose. But again, for the time being, we would ask you to return to your original location for your second dose. Very few primary care offices are getting allocations of vaccine, so it's doubtful that your PCP's office will have it for you in the near future. I'd like to address some concerns around who needs to get the vaccine from an employee standpoint. First of all, there are rumors that this is mandatory. To be clear, it is not. Just like the flu vaccination, you are strongly encouraged to get the COVID-19 vaccine as soon as you can. This not only protects you, but also our patients and your family members. There are no plans to make this vaccine mandatory. But remember, regardless of whether you get the vaccine or not, you must continue to wear a mask, distance, avoid crowds, and wash your hands frequently. Some have also asked if this will be an annual vaccine like the flu. We don't know how often the vaccine will be recommended yet. Time will tell, and we will get you that information as soon as it becomes available. In closing, I want to encourage all of you, clinic staff as well as all employees, to get the COVID-19 vaccine. We have all seen the devastation COVID-19 has created across the world, and even in those we know and love. The benefits, in my opinion, absolutely outweigh any side effects you may encounter. Side effects, if they occur at all, are generally very minimal and short-lived. This is something that can change the course of this pandemic, and you can be an integral part of that. Please consider this and make the right choice for yourself and your family. Now, back to you, Dr. Eickhoff.
I hope you get your vaccine as soon as you are able. I got mine. I've even given some. I know this is a scary time for everyone, and we're all tired, including healthcare providers like me. But we finally have a light at the end of the tunnel, and while it's going to take a while to get the vaccine to everyone who wants it, we will get there, but only if we are all working together. I hope I've given you some useful information today and helped you make the right decision for you and your family. No matter what, keep washing your hands, distancing, avoiding crowds, and above all, please wear your mask. All of our lives depend on it. Together, we can stop COVID-19 and end this pandemic. Thank you.
Thank you, Dr. Eickhoff. I'm Jimmy Keenan, Senior Vice President of Clinical Operations. I want to encourage you to please get your vaccine. It's so imperative that we all take care of each other. I hope Dr. Eickhoff dispelled some of your fears, if you have any, and I ask you and encourage you to get the vaccination. We must be vigilant in adding to the solution by doing those things that we can do. like wearing our mask, washing our hands, and socially distancing. And now, most importantly, getting our COVID-19 vaccine. Please do your part. We are here to give you your vaccine, and we will make sure we keep you safe. Thank you.